active seated internal rotation. This is a great assessment tool to evaluate hip structure and to figure out where the weaknesses and limitations come from in an individual. So what you're gonna do is either find yourself a massage table, a plyo box just like this, but it's high enough that if I sat all the way back, my feet are dangling. And that's on purpose in order to check internal or external rotation. But in this case, we're gonna go internally. So to make it active, I'm gonna be doing the assessment myself, whereas passively you would have an athletic therapist, clinician actually using their hands to check. So in this case, you need to get a little foam pad or possibly even like a yoga block, and you're gonna put this guy right against the knees, and I want you to actively press and crush this guy. And that's gonna activate the stabilizers and your core to show you how much active range of motion you have. From there, with your hands, you're gonna place them on your hips, and this is gonna give you another clue whether or not you're compensating. So what you're gonna do with your feet now, we're gonna start with our left side. We're gonna go into internal rotation of the hip, come back down, and then same thing on the other side. And what I'm looking for is if there's a difference between left and right. So left side, back, right side, back. Once again, left and right. While you're filming yourself, you can see a couple things. I tried for this video not to compensate and do one of these. A lot of individuals, when they get to their tight side, you'll see their hips, their whole body kind of shift, and even looking at facial expression is going to give you a lot of information if one side's tighter or possibly even have some painful patterns. If there's pain, most likely it's going to come right in front of that hip where that hip capsule gets kind of tight, and even being in this flexed hip position is going to really challenge internal rotation. So this is going to give you a lot of information in regards to squatting, lunging, or anything like that. So pay attention to what side is tighter, and this is going to dictate the program and what kind of stretching techniques and what kind of soft tissue strategies you'll be doing in order to improve it.